you feeling today?
I'm not well. Actually, I had fever for last 5 days.
Okay, fever for 5 days. Do you have a cold as well?
I have chest heaviness.
Okay. And any other aches and pain?
I have pain in my ear also.
Okay, alright. So what I'll do here is I'll register you.
Okay.
And I will get you to consult with our doctor.
Okay. Okay.
Hello doctor, can you hear me? Okay. So we have a gentleman here today.
And has not been feeling so well for the past 2 days. Okay, so you've been having fever for 5 days, right? And since yesterday, you've been feeling slightly short of breath, and your chest feels heavy, and you've been coughing badly. Do you have pain in the throat as well?
Yeah.
Do you have body ache, joint pains? Your knees hurt. Fine. Do you find any rashes anywhere on the skin?
It seems like rash, but I'm not sure at all.
We will do a blood test on you, which is for ruling out dengue, and we'll take an ECG just to make sure nothing is wrong. And I'll take a look at your chest x-ray, your blood tests.
I am checking his mouth with the multi-purpose scope right now. Again, please guide me through the process and see. You can see clearly.
Yes, I can see the back of his throat. It looks a little inflamed, a little red, but otherwise it's fine. Okay, I can take a look at his ears, please.
Please tell me if you can see.
Yes. Fine. Go in a little bit further. That's it. I've seen the tympanic membrane. Thank you. Okay. So, ma'am, I would suggest that you please draw up the blood for the investigation. We are doing a dengue test on him, as I've told him, and you would also please do an ECG on him. While you're getting this done, I will just write out his medications. Yeah.
We're now going to draw the patient's blood for a 14-parameter blood test. Now we have drawn the patient's blood and we're going to use the biochemistry analyzer to analyze 14 parameters of blood, including AMY, ALB, ALP, ALT, AST, TB, TC, TG, TP, creatinine, GGT, GLU, and urea. Here is a reagent disc that we'll use for the purpose. Here is a calibrated 100 microliter of pipette to draw out blood. Here we have emptied the 100 microliters of blood into the reagent disc. Now we are going to use the biochemistry analyzer to test the blood in 12 minutes. Now we start the test.
Okay, the ECG is done. That's great. I'll take a look. Yes, the ECG looks normal. It's within normal limits. Fine. Thank you so much, ma'am. I have finished typing out his medication.
You will get the medicines from our digital dispensary in 5 minutes.
Thank you.
Thank you.
Hello, ma'am.
Good afternoon. Yes?
Good afternoon. We have a patient here.
Okay.
He is complaining of chest discomfort and headache for 2 days.
Okay, so you're having headache for 2 days. How bad is it? Is it very bad, very severe, or is it just a mild form of headache?
It's moderate.
It's moderate. Okay. Have you had this kind of headache before for which you needed medications?
No.
No. Okay. Are you having any cough, cold, or any associated symptoms like neck pain, having difficulty
No.
in seeing things around
No,
you?
no.
Nothing. Are you having chest discomfort also?
Yeah.
Okay. Since when are you having chest pain, sir?
Since morning.
Okay. You're having chest pain since morning. Has there been any previous episode of chest pain? I can see that your blood pressure is 150/100, which is a little on the higher side. So, do you have hypertension in the background?
Yeah.
Okay, you are hypertensive. What medications do you take for that?
I'm taking amlodipine 5 mg.
Okay, so you're taking amlodipine 5 mg, and that would be once daily, I think?
Yeah.
Okay, so you are already on amlodipine, so let's add that to your medication list. I would want to do an ECG on you, as well as a certain routine blood tests. In the meanwhile, I'm just running his symptoms by our differential diagnosis system and trying to get a standard treatment plan on him. Sounds good?
Okay, ma'am.
Yes, thank you. So here on the system, I find that there is headache and chest pain. So let me just run the differential diagnosis on that. Yes. So he has headache, which is of abrupt onset, and he has also told us of abdominal pain, chest pain. So we view the disease list here. I have not seen the ECG as yet, but on him, the uppermost diagnosis would be unstable angina. So I am marking out unstable angina here, and I have got unstable angina on my disease list. I am just viewing the standard treatment protocol, which asks me to give aspirin 150 mg once daily for 10 days, and I'm okay with that. I would just be visualizing the patient history. So I see that sister has loaded certain reports for me here. I would just take a
Yes,
look.
ma'am. I have sent the reports.
Yes, I'm just taking a look at the ECG, sister, and I find that the ECG is normal. The heart rate is normal with a normal sinus rhythm. There are no STT changes on him, no LVH pattern either. So this is essentially normal ECG, which is good news.
Okay.
I will just visualize the param 14 if that's ready. Yes, it's
Yes,
ready.
ma'am. I'll
Thank
send
you
it.
so much, sister. I'm just looking through it. So ALT looks good, so does the albumin. SGOT is perfectly fine. Amylase is normal. His creat, blood glucose, bilirubin, urea, and total protein. The entire range is essentially normal, so that's good news. Aspirin 150 mg tablet once daily. And as far as contraindications are concerned, aspirin does have some contraindications, which includes liver diseases, but we've just gone through his liver parameters and they look absolutely fine. He does not have any history of hemophilia. Does he have any history of gout? Could you just ask him, please?
Do you have any history of gout?
No.
No,
Okay,
ma'am.
that's good. And any peptic ulcer disease? Any peptic ulceration that he has been previously diagnosed with? That's fine, as expected. Okay. Since we are giving paracetamol as well as aspirin, we need to cover this patient with a PPI. I'm just going to give him an omeprazole. Just a second while I type that out. Yeah. So omeprazole capsule we are going to give him, and that would continue for 10 days till he. Now coming to his hypertensive medications, he has told me that he is already on amlodipine, and we can continue the amlodipine. That's not a problem because he's already adjusted to it. So 5 milligrams of amlodipine continues as before, and he can continue to take that for 10 days, which is once daily. So we dispense 10 tablets for him, and he can take that in the morning after breakfast. Next I'm going to add a telmisartan for him, because in spite of amlodipine, his blood pressure is still on the higher side. We start with a lower dose, which is something like 20 milligrams. He can just take that for the next 10 days, which is again once daily, and he can come back to me about 10 days later, and then we would revisit the issue of how well his blood pressure is being controlled. Again, telmisartan has only liver disease, lactation, pregnancy, and biliary obstructive disorders. We've already seen that his liver function tests are fine, and lactation and pregnancy does not apply for him. So we can go ahead and give him this medication. please thank the patient for coming and consulting us today, and please reassure him that he's doing fine. All his test results are normal, and his blood pressure, we'll get it under better control with the medication that I've added, hopefully. I'm giving him a next review date coming up. Today's the 10th, so he comes to visit us. 20th happens to be a Sunday, so let's call him on the 19th and we can review all his tests once more and his symptoms as well. Okay, I will just be sending a prescription and then I'll be ready for the next patient. Thank you, sister.
Thank you.
I'm just getting through the prescription. It has all the risk factors, complaints, diagnosis, medications with their doses and timings mentioned adequately, along with the drug-alcohol interactions and the drug-food interactions. The review date for this patient is on the 19th of August, and he will visit us earlier if he feels the necessity to.